Hello, faculty, administrators, and family members. Congratulations, graduating class of 2022. We are so excited to be celebrating having completed our various graduate nursing programs and having done so during COVID times. I'd say that makes us a group of amazing, talented, and honestly brilliant graduate level trained nurses that are graduating from this esteemed institution, the University of Texas at Austin. You have no idea how badly I want to paint a rosy picture of what we have to face right now in this somewhat post-pandemic world. But I honestly don't feel I can do that. To quote the Grammy-winning singer-songwriter Olivia Rodrigo, "It's brutal out here." For those who don't know who Olivia Rodrigo is, I'll admit I didn't at one point either. But being a Disney parent, her standout popularity is hard to miss. To be succinct about it, she's a different, goth punk Hispanic young woman in a world of mostly token high schoolers, singing about how hard it is to love and live in a world that isn't made for her. I have to admit right now, at times, I have felt like a nurse in a healthcare system that isn't made for me. As an alternate entry student, I actually got my bachelor's degree in music performance from the Juilliard School. I was inspired to go back to school while I was pregnant with my second child by the mother of one of my piano students who'd gone back to school to become a nurse herself. Is now a lactation consultant, and it actually helped me greatly with breastfeeding my first child by noticing that he had a severe tongue tie, which was why I was crying every time he latched on. She helped me find a dentist that would help us get that fixed the same day so I could stop crying. I was so inspired by her story that I went home that day and signed up for the first prerequisite classes I would need before applying for this program. A week later, I found out that my daughter had a congenital heart defect that would completely change my reasons for wanting to go to nursing school. After seeing how her team of cardiologists, cardiac surgeons, nurse practitioners, nurses, and assistive staff took care of her, I decided I wanted to try and work with them when I was done. As soon as I passed my nursing wards after my first year of the program, even though I still had 2 more years of nurse practitioner school left, I jumped into working in the cardiac ICU. Boy, did I get a wake-up call. The intensity of that unit, the constant stress that those nurses were under, the threat of potentially having a baby die because they cried for too long, or just because, honestly, or the risk of being yelled at by a doctor or fellow nurse, I just couldn't handle it. I decided after crying on my way to work and on my way home from work almost every day that I had to leave that unit. But before I left, I decided to do something about it. During that time, I was taking a course at school on leadership that used a textbook written by a couple of businessmen that I felt could apply to anyone and anything. I even felt like I could apply leadership skills to parenting my kids. So I bought an extra copy of the book, set up an appointment with the chief medical officer of the hospital and one of the cardiac surgeons, and gave it to him in the hopes that maybe, just maybe, he could do something about the culture of this unit because it really needed to change. In my opinion, there was danger of something really horrible happening if the leadership didn't do something about this unit and its culture, because it was really obvious that there was serious lack of respectful communication here. And the chief medical officer, who happened to be a woman, agreed with me. This doctor, who happened to be a man, did not seem to heed my advice, as less than a year later, he was suspended for assaulting a nurse practitioner for grabbing the wrong item out of the supply cart during a code situation. Not exactly appropriate communication. I feel for this doctor, don't get me wrong, although I feel a whole lot more for the nurse practitioner. ICUs are some of the most stressful places in the world to work. The patients are the sickest, the stakes are the highest, and the stress is the most intense. And as COVID times has taught us, it's those healthcare workers that have been under those intense pressures for the longest that suffered the most during the past 2.5 years. Even more reason, though, to start listening instead of reacting, communicating instead of assaulting. Otherwise, the system will break down. This doctor was forced to take a break after that assault. But maybe if he had taken a break before that, that incident never would have happened. I noticed quickly in my first year that just about every class made a really big deal out of the concept of self-care. I'd never heard of this term before, not really something I dealt with in music performance, although they definitely could use it in that realm as well. We all could. But I kept thinking to myself, man, they really are hitting this point quite hard, aren't they? Although we can't self-care our way out of poor leadership and poor communication, I did learn that taking a break can at least give us an opportunity to think for a moment and possibly consider that maybe we need to be better leaders and better communicators. It was definitely too late in this situation for that, as unfortunately, I was not the only nurse that left because of this culture, not by a long shot. Nurses left in droves, just like nurses are leaving the profession of nursing in droves. Great nurses who have so much to offer patients, who just can't deal with the politics, the egos, the lack of safety, and no one listening to them. And let's be honest, nurses can be kind of mean. As a new nurse, it kind of felt like going back to high school all over again. There were the popular nurses, the cliquey ones that didn't want anything to do with you, didn't want to help you or your patients. Then there were the goth ones in the back that kept to themselves. They didn't want to be spoken to unless absolutely necessary. The other new nurses, of course, wanted to help, but didn't know anything either. The older, more experienced ones were generally willing to help, assuming they actually did things correctly still, meaning they weren't going rogue and saying, "Don't do what I do. It's really not what you're supposed to be doing, but I still do it anyway." Then, of course, there are the angel nurses who are just amazing and know exactly what to say and what to do at all times, are always willing to help, and never make you feel like an idiot for not knowing how to do something. It was those nurses that I saw leaving or killing themselves working 7 shifts a week because no one else wanted to work. And that worried me more than anything, because those are the ones who are needed right now, more than anybody else. Those are the ones who know the technique of caring without falling into the trap of sympathy. Those are the ones who empathize the way our Brene Brown reminds us to do, by simply listening, holding space, withholding judgment, emotionally connecting, and communicating that incredibly healing message of, you're not alone. So I left the ICU and went to work on the oncology floor. While I was working there, I met some of the strongest patients in the world. Kids who are fighting cancer are some of the most amazing humans you will ever meet. One parent, whose daughter is now an adult, told me a story of her daughter who was fighting such a rare form of cancer that she was being put in textbooks and studied by doctors from all around the world. One day a doctor told her tearfully, "I don't think I got all the cancer out. There's nothing left we can do. There's a 90% chance you could die from this." And she responded, "That means there's a 10% chance I'll live." And of course, she's still alive today. But I also heard multiple stories from parents where they took their child to their pediatrician over and over and over again, telling them that something was wrong. And they were told the child was fine. Everything was fine. And it turned out the child had an advanced cancer that ended up killing them because it wasn't caught sooner. Too often these stories come from Spanish-speaking families, and that particularly broke my heart because these parents could tell me these stories in the middle of the night after their kids went to bed, and they wouldn't be able to sleep, concerned that their child wouldn't make it. And often they were right. These happen to be doctors, not nurse practitioners. Let me point this out to you, although I mean no offense to doctors. I love doctors. My father is a doctor, and one of the most amazing and intelligent men I know. He was born and raised in Haiti from a Seventh-day Adventist pastor, went to medical school in Argentina because they have free university for all, in a language that he didn't speak or understand very well, and not only did he succeed, but excelled, and ended up in the United States to do his internship and residency in another language that he didn't speak or understand very well. He has saved lives of countless men, women, and children of all races, ethnicities, religions, and backgrounds in the inner city of Los Angeles. And yet, even being the amazing human being that he is still judged for the color of his skin. It doesn't seem to matter how amazing someone is. We as people of color seem to still struggle to be heard. When Serena Williams, the greatest tennis player ever, not arguably, mind you, tells her healthcare team over and over and over again that something is wrong with her, that she can't breathe after giving birth to her daughter Olympia, and they keep telling her everything is fine, you're fine. When everything wasn't fine, you know something is wrong with our healthcare system. She had a blood clot in her lungs. That's why she couldn't breathe. She could have died if she hadn't kept being her own advocate and kept fighting them and insisting that she knew what was best for her. But that wasn't her job. Her job was to enjoy her baby. Her job was merely to let someone know that she felt like she couldn't breathe. And that someone should have listened. That someone that she spoke to happened to be a nurse. When she said she felt like she was dying, that nurse told her, "I think all this medicine is making you talk crazy." It's not just doctors. It's not just nurses. It's not just administrators. It's not just insurance companies. There is something wrong with our system. As nurses and nurse practitioners, we are taught to consider not only the disease, but the whole person, even the whole family when we speak. We consider that maybe we don't tell a child that have a 90% chance of dying, and maybe we consider speaking to the parents before talking about death to a child. And maybe we listen to parents when they say something's wrong, because parents know their children better than we do. We are taught to listen. And if there's anything that we desperately need right now, it's people who listen. Regardless of whether the person who is talking is as amazing as my father, or Serena Williams, or you, or I. But we are not listening. And just like the surgeon who didn't listen and ended up in trouble, I'm afraid that our system is in trouble and will fall apart if we don't figure out what to do about it. My mother is also a nurse, graduated in November of 1972 del Colegio Adventista del Plata, Escuela de Enfermería in Argentina. She works in adult oncology. She's also amazing. Just ask all the patients who call her their hero. 50 years she's been a nurse, and still going strong. I'm worried that most nurses today will never make it that long. I don't think it's an exaggeration to say it's a trying time to be a nurse. We've been asked to put our lives in jeopardy in ways we never thought we would. Whether it's literally, because our safety is not taken seriously, or mentally, or emotionally, or spiritually. Because again, no one is listening to us. Some of us more than others have been asked to work beyond our limits, put our work before our families, put our work before ourselves, more so than we did already. Because of this, we've lost way too many of our colleagues to the fray, to burnout, to the COVID backlash. So much so that it can almost feel like we, as master prepared nurses and doctorate prepared nurses, are continuing in or re-entering a workforce that will be so underwater and drowning that our degrees will be futile. But it's imperative that we don't go down that path of negative thinking, even though it's true that something is wrong. Because this is exactly why we became graduate prepared nurses, to find ways to help our fellow nurses and nurse practitioners. The Disney company has become oddly divisive lately, so maybe I shouldn't bring it up. But as one example of so well. The Disney company has become oddly divisive lately, so maybe I shouldn't bring it up. But as one example of when companies do heed advice, its subsidiary, Pixar, listened to one of its employees, casting director Jessica Haidt, when she realized that their films were heavily favoring male voices over female voices by a ratio of 9-1. She took this information to the director of the film she was working on, Cars 3. He and the rest of the team took this information and decided to make a change, making characters female that hadn't been before, therefore giving females a quality of voice more than they had had before in Disney animated films. After that, Pixar decided to use that technology for all of their subsequent films to make sure that females had equal speaking parts to males from there on out. And that's why I happen to love Disney's Pixar, because they listen. And not only do they listen, they make immediate, positive change when they know something isn't right. I know that we are not Disney's Pixar. We don't have that kind of money for sure. But I hope that we can find ways to make that kind of change in our own ways with our practices, by listening and making changes to our systems. Whether it means using those evidence-based tools we spent hours researching and figuring out how to put on online posters instead of physical posters, thanks COVID, or it's starting new research into ways to get these nurses back into practice. Or it's encouraging a fallen nurse to go back to school to become one of us. Or thinking even grander, finding ways to change the system that we are working in so that we stop losing so many to the fear of persecution for honest mistakes, to the fear of not being able to help those who need it, to the fear of losing ourselves to a system that doesn't listen to our needs. However it is that we use the tools that we've gotten here, they are exactly what we need to get us through this trying time. It takes a nurse, as they say, a UT graduate nurse, and we will get it done. Congratulations again, fellow graduates, and thank you for listening.